Welcome to the ultimate guide to finding the best cataract surgeon. Unlike many videos that focus only on fancy lenses or high-tech lasers, I'm here to emphasize the real game changer, your surgeon's experience and track record. Hi, I'm Dr. Ilan Cohen, a board-certified cataract surgeon. Over the last 25 years, I've helped tens of thousands of cataract patients achieve clear glasses-free vision. In this video, I'll share exactly what you need to look for, key questions to ask, and how to avoid pitfalls that could compromise your results. We'll discuss the importance of surgical volume, premium lens expertise, and critical metrics like complication rates, all insights drawn from my years of perfecting these procedures. By the end, you'll be fully equipped to select a surgeon who can provide the sharp, youthful vision you deserve. So what does cataract mean? It means the lens inside the eye is cloudy, blocking the light. Cataract surgery involves removing that lens and replacing it with a new one. Traditionally, the main goal of cataract surgery has been to remove the cloudy lens to improve light entry into the eye. While this often results in crisper vision, achieving a perfect 20/20 outcome, or significantly reducing your dependence on glasses wasn't always the focus. Now, here's where it gets interesting. Modern technology has transformed what's possible. But let me ask you, if you had just one chance to restore your youthful clarity, would you take it? The introduction of multifocal and extended depth of focus lenses was like unlocking a new superpower. These lenses can provide near, intermediate, and distance vision, often without the need for glasses. Plus, toric lenses for astigmatism added to the clarity that cataract surgery can deliver. However, there is a critical twist. These advanced lenses require precise measurements, specialized training, and a skilled surgeon who can adjust their technique accordingly. Many patients mistakenly believe that technology alone guarantees success. But remember, a top-of-the-line lens in the hands of an inexperienced surgeon is like a high-end sports car driven by someone without a license. So, what steps can you take to ensure you choose the most skilled surgeon to meet your goals? If you only focus on star rating or recommendations, you may miss the critical factors that set an average surgeon apart from an expert. It is no secret that there is no substitute for experience. But how much experience is good enough, and what type of experience should you look for? You want a surgeon that performs at least 1,000 cataract surgeries per year. Volume builds mastery. A surgeon performing 1,000 or more procedures each year has encountered virtually every eye shape, complication, and lens alignment issue you can imagine. Next, if you're looking for a sharp vision without glasses after surgery, you need a premium lens specialist. Premium lenses and laser-assisted cataract surgery require specific expertise, which is different than old-fashioned cataract surgery. Device calibration, lens calculation, and positioning and astigmatism correction are critical. So is experience with a wide range of lenses and their suitability in each individual eye. But here's a critical question you need to ask yourself. How do you actually spot a high-volume surgeon with premium lens experience and not just someone claiming to be an expert? The answer lies in specific questions you ask and a bit of research. Let's go through them. If you focus on star rating or word of mouth alone, you might miss the real details that separate an average surgeon from an expert. Here are the exact questions to bring to your consultation. First, ask what percentage of your surgeries involve premium lenses. If more than 60% of their patients choose multifocal, extended depth of focus, or toric lenses, you found someone deeply familiar with advanced techniques. Next, ask how many cataract surgeries do you perform annually? Look for a surgeon who does over 1,000 procedures a year. This shows they have honed their technique through sheer volume. Then you ask, what is your complication rate? The national average is 1 in 100. If the surgeon isn't close to or significantly better than that statistic, it's worth a second look. Follow up with what equipment do you use for measurements? Top surgeons employ cutting-edge biometers like the LensStar, the IOL Master 700, or Argos. Best if they have access to all three for cross-verification. Next, ask what happens if the vision isn't good after surgery or the lens isn't a good match for my eye. A confident expert will typically respond, "I'll exchange it myself," showing a willingness to take full responsibility. Hesitation about exchanging lenses that don't work properly is a major reason for unhappy patients. Some cataract surgeons are not very experienced with lens exchange procedures and are hesitant to perform them even when necessary. I've seen this countless times in my own practice with patients who came from elsewhere after suffering from poor vision for a long time post-surgery, when all they needed was a straightforward lens exchange or even a simpler laser procedure. But you might be wondering, is that all it takes? Just a few questions? Actually, there's another layer to consider: red flags. If you spot them, don't ignore them. Your vision is at stake. Let's uncover the warning signs you should look for. Some surgeons or practices may avoid giving straight answers or pressure you into making quick decisions. That's a major warning sign. Be wary of evasive language. If they don't provide numbers or volume or complication rates, it's reasonable to question what they're hiding. Also, beware of a one-size-fits-all approach. If they promote a specific lens or a technique without truly considering your lifestyle or visual needs, they might be more focused on selling rather than serving you. Watch out for overly aggressive sales tactics. Premium lenses can be pricey, and if they use fear or rush you to sign without a thorough discussion, proceed with caution. But there's something many people overlook. Even if a practice doesn't raise any giant red flags, how can you truly confirm they deliver top quality results? That's where your next step comes in. You might find a surgeon who says all the right things, but remember, words aren't enough. Here's how to dig deeper. First, ask the same question from the surgical coordinator or another staff member. Check for consistency in their answers. Also remember that busy eye surgeons usually are fully committed to surgery. They don't usually perform general eye exams and routine visits. They have other doctors in their offices who do that. Next, request real patient stories. Look for experiences from patients who share similar vision goals or have comparable eye conditions to yours. It's also helpful to ask other physicians and even optometrists about which surgeons they trust for their patients and family members. It's easy to be dazzled by the latest surgical lasers or fancy lens brochures, but remember, technology can't replace experience. For example, the use of a laser can increase accuracy and safety, but a lack of experience with laser cataract surgery can ironically raise the risks. Comprehensive planning is crucial. From preoperative measurements to postoperative follow-ups, every step must align with your unique vision goals. The difference between good and great outcomes often lies in the small details. If you've chosen the right surgeon, they'll guide you through each step of the process. And it's crucial that you play your part as well. Now you have the full roadmap ahead of you. Understand why your surgeon's skill is more important than flashy technology. Be sure to ask the right questions about their volume, complication rates, and their experience with premium lenses, and keep an eye out for any red flags and verify their track record. You might be wondering, is it really worth the extra effort? If sharp, youthful vision and a one-time chance at a glasses-free life matter to you, then yes, the answer is a resounding yes. Don't gamble with your eyes. Some of the viewers have been asking me about my own surgical statistics. So here it is. I perform approximately 2,000 cataract surgeries each year, with 85% of those involving premium lenses. Over the past 10 years, my average complication rate is about 1 in 1,000, which is almost 10 times lower than the national average. There is one final insight we haven't touched on. What if you had cataract surgery and you're not happy with your vision? Can anything be done? Watch this next video to find out.